Good evening. Hi. It's Tuesday again. I feel like Thirsty Tuesday doesn't sound quite the same as Thirsty Thursday. Anyhow, happy hour Q&A on Tuesday. Again, sorry, we had late dinner, so trying to finish my pizza. We've been trying to do a plant-based diet for the past 6 months, but we're not very good at not eating dairy. I'm pretty good with the meat, but cheese. Anyhow. But it's better than eating hunks of meat, right? Okay. So, let's see. I think I'm going to give it just another minute or two, see if anyone else joins us. But we're doing mint juleps today because it is Kentucky Derby season, even though sadly they've postponed this year to September. But, I didn't really care anything about horse racing until I met my husband, and then he kind of likes going to the tracks. And he had a co-resident when he was doing his residency training who, their family is from Kentucky. They live in Louisville, and they really enjoy the Derby. So we went down there. When was that? 2011 or 2012? A long time ago. And man, they went all out. All the women in their family, they go to a milliner and they have custom hats made. They had like big house parties, and all their friends and everyone just got into the spirit, into the swing of things. And unfortunately for me, I had to fly back the same day as the Derby, so I didn't even get to see any races, but I got to see the track. I got to have a mint julep, and then I had to rush back because I had my shift in the ICU, which was pretty miserable after going from the south where it's warm and beautiful and everyone's out to have a good time to being back in the surgical ICU trying to manage really sick patients. But anyhow, that was the life we lived back then. Now it's so much better. I can make my own schedule, sort of. Okay, so mint julep. Mint. Surprisingly, I had a hard time finding mint, even though I feel like otherwise I see it everywhere. But again, since we're making this family-friendly and all ages, I'm making the mocktail version. So this one was actually really more of like a pre-prepping, very basic, and it's the same recipe for the grown-up version and for the kiddo version. But basically all I did earlier was make some of this kind of like lemon mint simple syrup. Just cook down some sugar and some water, and then once it's all dissolved, took it off the heat, threw in a bunch of mint leaves and let it sit. Got my lemon zest and lemon juice. Our neighbor has all these fruit trees, and she just left some fresh lemons for us yesterday, so I figured I'd use those, and I popped it all in the fridge. And the recipe that I'm using is more like an icy almost, which I'm excited about since it's getting warmer now. So I took a bunch of ice and threw it in my Vitamix, and then it looks kind of like shaved ice now. I don't know. Ooh, let me go get that. Well, kind of. It's like snow. So I'll just take my snow, and it says to mix in the mint leaves. Alright, what the heck? A bunch of mix. Mint leaves. Okay, maybe this isn't exactly how they did it, but, improvise. I'm just softening up the ice so I can fit in the cup. And I guess the idea is they're going to fill the cups with this minty ice. And I'm using copper cups here, as at first we were thinking maybe we'll do mules, but I'm like, oh, it's Derby, let's do Mint Juleps, and these are cups that my husband and I got made for our wedding, and we gave them out as our party favors. But basically, we had a lot of fun, got married on the 4th of July, had such a good time that we decided to name our daughter after the town that we got married in. And hopefully, once all this craziness is over and when she's a little bit older, we can take her back there to see the place that made such an impression on us and where we started our life together. Right here. Okay, so I'm just gonna put into this minty ice, make a big mess. Ah, make the hubby one too. So, I mean, it says just to fill them up to the, I'm making a hot mess. Fill them up to the brim with the ice and mint mix. And if you want it to be the grown-up version, then this is the point where you can add your bourbon. Seeing as we're talking about Kentucky, do bourbon. I am going to do just the syrup. So that's really all you do is take the syrup that you made earlier, and I think they said, oh, of course I can't open this. Take the syrup and put in about half a cup. Half a cup, pour it in. Oh, well, that smells nice. Woo. Okay. That's the only part I don't like about this stuff is that there's so much sugar in simple syrup. Anyhow, looks kind of like this, a little bit festive, and I guess you're supposed to kind of spoon it. So I'm going to bring one over to the hubby and enjoy the other one myself. Here you go.
Thank you.
Okay. The other exciting part of my day. Look, our baby grew us grass. It's so cute. Oh, okay, on to business. So, topic tonight is tummy tuck. You know, as plastic surgeons, that's one of our bread and butter procedures. Very popular among people who have lost a lot of weight. Doesn't have to be massive weight loss. It can be after childbirth. Childbirth is another big reason that people have this procedure done. And essentially, all it is you're taking that extra skin and fat that's become very stretched out, stretch marks. You know, you have that kind of flap of tissue that's hanging over your waistline, or something that you feel like you always have to tuck into Spanx or into a waist trainer or into a girdle of some sort in order to give yourself that flat tummy look. And no matter how much you exercise or how much more weight you lose, that skin just does not want to tighten. Those stretch marks don't go away, and you're left with this, you know, kind of silhouette that's not very feminine. And you know, a lot of women, they say, you know, I don't really believe in plastic surgery, or you know, my family doesn't really want me to do this, but this I'm doing for myself. And there's some people who I've consulted with, and they feel a little bit guilty. You know, they say, I don't want my children to feel like I didn't love my body, because my body carried them and I love them. You know, and as we have our discussion, I always had to talk with them about that, because, you know, at the end of the day, any cosmetic procedure that you do for yourself should be and is absolutely for yourself. You know, if you're doing it for any other reason than that, then I think you need to go home and look at your priorities and kind of think about the reasons why you're even considering this. The people who are healthiest and who heal the best and who have the best results are the people who come in with that mentality. I'm doing this for myself. I deserve this. I'm going to get through this fine, and I am going to rock my new body. So Tummy tuck, again, is one of those procedures that you very commonly seen together with breast procedures or liposuction or a plethora of other procedures, and they're called mommy makeovers. But since we talked about breast last week, we're just going to focus on tummy this week so I don't keep you too long. Hi everyone who just joined us. We made a little fun version of a mint julep in celebration of the Kentucky Derby, which was supposed to be this weekend, but is now going to be in September. But we'll still drink a julep to celebrate for them. And we're talking about tummy tuck. So I'm just going to go through basically what I do during a consultation for tummy tuck. And I encourage you, if this is something that you're thinking about, to actually go and stand in front of a full-length mirror, in your bathroom, whatever, in a way that you can look at your tummy. So when I come into the consultation, you have you in a gown, and really for me, it's important that you don't have your undergarments on. And I know a lot of people come in and say, I don't feel comfortable taking it off, but the scar we put, I want to show you how low we're going. And I also want to show you what happens when we actually tuck in all that and take away all that skin and give you that tightened effect. And I also want you to take a look at the mons pubis, which is in slang what people call a fupa, and I'm not going to say what that is because it's not quite appropriate, but this is an area that tends to hang on to fat, and that you might not notice now when you have extra skin and tissue before your tummy tuck, but you might notice after. So I always talk to people about that too, whether or not we're going to do some liposuction there. And then of course, we had a segment on labiaplasty a couple weeks ago, but labiaplasty is also something that we can do at the same time as the tummy tuck. And again, this might be something you don't notice until your tummy is nice and tight, and all of a sudden you say, woo, what is this camel toe? Why didn't I take care of this? Or why didn't the doctor mention it? So these are all things that we talk about during consultation. But let's just focus on purely the tummy. All right, I'm going to move this so you can actually see me. Okay, so if you're standing in front of a mirror, you're looking at yourself from the side. I don't want you to have tight leggings like I do on. What I want you to, whoops, sorry, that was me. What did I just do? Oh, okay. So what I have you do is we stand in front of the mirror together. We look at the mirror together, and you point out to me what you hate or what really makes you uncomfortable about yourself. So most of the time, and I hope you don't mind, I'm going to show you my tummy. Most of the time, what people look at are their belly buttons. And if you have a lot of extra skin and tissue, your belly button might be sad looking. It may be hard to find. It may have this kind of frowny face to it. For me, I have a little hernia. That just means that, the fat is kind of poking out of the hole where my tummy should be, my belly button should be. So now I don't have an innie that's cute. I have this little button here. Thank you, baby. And then also look at the amount of kind of fat and skin and tissue that's hanging over down here. And what I have you do is I have you look in the mirror, and I have you take all that tissue, and I want you to pull it up. So I want you to pull it up as tight as you can. And when you do, that kind of reveals this lower area here. And at that point, I show you where we put the scar. And it is low, low. Now remember, right now, our panty lines, the cut of them, tend to be fairly low. Not as low as they were, 5-10 years ago. Now we're getting back to the high-waisted look, but we're not in those French cut bikinis or French cut undergarments that people used to wear back in the 90s. We are still in fairly low kind of hipsters. So what we want to do is to place the scar low enough that whatever undergarment or bathing suit you're wearing, you'll be able to wear it without showing off any scar. Now, once I have you lifting that up and once I show you where the scar will be, then I tell you that you can rest down that skin and tissue. And we look at it together, and again I say, this is where your scar will be, and it usually goes from the edge of where your skin and fat bulges over to the other end. And in some people, if you have more tissue that wraps around, we may be talking about an extended tummy tuck versus just a regular one or a mini, but since we're going to focus on just the regular, goes side to side from where your skin and tissue just kind of taper off. That's how long your scar will be, and it will be quite low. So I usually measure about 5 centimeters from kind of the cleft of your labia here. So it's down, low, low, low. Then I have you drop that skin and tissue so that we can look at it together again. And what I tell you is from the incision to just above the belly button is where I'm going to remove all of that skin and fat and soft tissue. That will take care of a majority of stretch marks that people have. Now, most people tend to have stretch marks around the belly button and then lower down because this is where the pressure is from the baby that you have or from the weight gain that you've had. So all of that will be gone, and what becomes your new belly is everything from the belly button up to where your ribs begin. So all of this gets stretched and pulled down and sutured down here. And you may say, how in the world is that going to happen? But just imagine how much this tissue has distended and stretched. This tissue has undergone that same trauma. You just don't see it quite as much because it's held up on top. But once I release all of that during surgery, this pulls all the way down, and you are left with tight, flat, smooth skin with maybe a little bit of residual stretch marks, but it's going to be way, way down here where you can easily hide it within your underpants or your bathing suit. Now, it's not just skin and soft tissue that we're fixing when we're talking about tummy tucks. The most important part of it is getting you that little waistline, right? Everyone wants to have that hourglass. I am shaped like a boy, so I'm not a really good example, but what we really want to do is to cinch in this waist, all right? And the way that we do that is during the consultation, again, I have you show me how you look when you suck in your breath. So if you're standing in front of the mirror, let everything rest, let it all hang, there's floppy gut, and then I want you to suck it in. And when you suck it in, that is the effect you get when I go in and correct your rectus diastasis, which is the widening of your 2 abdominal muscles, the things that give you the six-pack. They separate with weight gain or with childbirth, and when I bring those back together and suture them, that's when you get that tight little tiny waist. Now, this is all done inside. You're not going to see any of this on the outside, but that will bring the structures back into the midline and restore your core. And I got to tell you, a lot of patients afterwards, when they start to work out again, they'll say, oh my goodness, it's a world of difference. My back pain is gone. I just feel a lot more centered because now I'm not using muscles that are separated way out here. They're back in the middle where they belong. Okay, so that's the muscle tightening, and we talked about the skin tightening and skin removal. There's also the belly button. Now, like I mentioned, I have an umbilical hernia. So you can see I can push it in. It's like a little button. And that is something that I look for during your consultation too, because this is something that can be repaired during the tummy tuck. And what this is just a little defect in the fascia, and it's normal. Everyone has one. It's just varying degrees of how prominent they are and what gets stuck in it. But that little hole can be repaired, and then a new belly button is created. It's still the same stock, so I'm not cutting it off, at least, most of the time, and just making a new opening in your new tummy skin. So imagine this is like an apron. So think of my t-shirt as the skin. There's a lot of loose and floppy stuff down here. So what I'm doing is I'm cutting it, I'm lifting it up, I'm tightening the muscles, and then I'm pulling this down. So now I'm going to have this tight, nice tight skin, but I gotta make a new hole for the belly button. And that's called an umbilicoplasty, and making a new hole for the belly button. Now once that's done, we're gonna suture all the skin back together, and that's essentially a tummy tuck. Obviously, for pretty much everyone, I do throw in liposuction of the flanks or the love handles because, again, our goal is to give you that nice little hourglass shape, and a lot of that happens in a 360 fashion. It's not just the front or just the back. So we do the tummy tuck to flatten and tighten the front, and then the liposuction to give you that nice cut-in waist look, all right? Ooh. Lots of people that wave too. Sorry if I missed waving. Welcome, welcome. Thanks for joining us tonight. We talk about tummy tuck. All right, so loose skin, stretch marks, extra fat, gone. Very, very low incision, down, down, down low. Nice flat skin, new belly button with a fixed hernia, and then liposuction in the flanks here to give you that kind of carved in waist look. I do tummy tucks at the same time as Brazilian fat transfer to the buttocks, but this is something that we have to talk about carefully because I can't be as aggressive with the liposuction in the abdomen if I'm doing a tummy tuck at the same time because of blood supply. All right. How does the procedure work? How long does it take? And what does it feel like? Procedure takes probably about 2.5 hours or so. It's an outpatient surgery. You go home the same night. I try not to use drains. So I use a drainless technique, which involves quilting sutures. Or what we call progressive tension sutures. Now, not everyone is a candidate for this. Obviously, if your BMI, if you're a little bit heavier set, if you have any family history of bleeding disorders, if it's just kind of juicy in there when I'm working, I will not use that technique and I will place 2 drains, one on each side. But for most patients who are fairly normal size with just a lot of extra skin and some fat, I will do this drainless technique where if you think about how a quilt looks, where there, those little indents where you're tacking the layers of the quilt together so that it stays together. It's the same idea with the tummy. Again, everything is done under the skin. If this is my skin and tissue, as I pull down on the flap, what I'm doing is I'm taking the skin and I'm tacking it down to the muscle underneath so that it helps me tighten the skin more and also eliminates that dead space, that space between the skin and muscle, so that fluid doesn't collect there. Fluid likes to collect whenever you make a cut. Just think about when you scrape yourself, when you have a little cut, it gets crusty, like yellow stuff seeps out of it. What is that? So people want to get rid of that. And surgeons especially hate having that because seromas, which is the number one complication of a tummy tuck, it can be really, really annoying. It just means more frequent visits. Sometimes we have to drain you in the office. It takes a little bit longer to heal. Sometimes it causes a little bit of wound breakdown. We try to avoid that any which way we can. Discomfort. So everyone's probably heard horror stories about how painful tummy tucks can be. So we do a couple of different things to make it more comfortable for you. First off, you use a long-acting numbing medication during the surgery called Exparel. Now, Exparel is very similar to the numbing medicine that I use for things that I do in the office. However, this has been formulated so that you get an extended release, which means that instead of it lasting just a couple of hours, it lasts about 72 hours. And this is injected directly into that muscle repair because it's the muscle that feels the most sore from being honked together from the side all the way back to the middle. So take that Exparel medication, inject it along the muscle, where we put the stitches, and it gives a lot of relief for the next 3 days. That allows you to get out of bed. It allows you to move around and breathe and just feel a little bit more like yourself. I still do prescribe pain medications for you so that if you need them, you can take it, but this has made a world of difference for our patients. All right. For these procedures, since they are fairly involved, and even though it's an outpatient surgery, I do see you the day after. We have you in an abdominal binder, which is kind of like a waist trainer, just a stretchy band that comes around the tummy and holds everything in place. I do want you to take nice deep breaths and get out of bed. I want you to walk because, again, one of the complications of longer surgeries like this are blood clots in the legs. So I want to get you walking. You will be a little bit bent over for the first 2 days. Most people tells me it takes about a week until they're standing fully straight up again. But you're hunched over a little bit, mostly to protect that incision so that you don't have any tension on it so that the scar heals well. All the sutures that use are under the skin. They're all dissolvable. So there's nothing to really take out during the follow-up visits, although I do trim some knots here and there. Most people will have a little bit of scabbing, a little bit of wound breakdown, and then we just hold your hand and talk you through it, tell you how to manage it, and these tend to heal up beautifully. The scar themselves, or the scar itself, can take up to a full year to completely soften and fade. And I can tell you from my C-section, my baby's 13 months old now, and it's still raised, it's still a little bit tender. I've been using scar gels I massage, but I'm Asian, we're prone to keloiding. It happens, we see it a lot with Asian people, with African American people, and with Hispanics. Unfortunately, something with the pigment in our skin just makes us prone to these thick scars. So these are things that we stay on top of, we follow closely, and we'll try to make sure that as you heal, we try to preempt any wound healing issues and any scarring issues. The nice thing about working in a med spa is I have a lot of access to lasers. I've been pico lasering my own scar, so that I will let you know how that goes. It is fading, but it's taking longer than I had hoped. Okay. Alrighty. And then let's see. Activity. I have you take it easy. Most people need about 10 to 14 days of downtime before they are back to work, back to feeling like themselves. The first week is the hardest. I have to be completely honest with you. But after that first week, you're standing up straight again. Things are starting to relax. Things are starting to heal, and you are getting back on track to what you're doing. I do have you refrain from any strenuous working out for about 4 to 6 weeks, depending on how you're healing, and then I will show you certain little core exercises that I have you start doing before you ramp up fully to your range of activities. What else? And the same thing with swimming or going in the pool, about 4 weeks. Okay, so quick recap again. Tummy tuck, skin and fat. That's from the belly button down low. The scar sits very, very low so that you can wear a string bikini or something very low without showing anyone your scar. The extent of the scar, I think you'll hear a lot of people say hip to hip, but it really varies by the individual. I would have you look at your own skin and tissue in the mirror and see where it tapers off. For some people it's here, for some people it's here, for some people it wraps around the back so that your treatment is tailored to you. The muscle repair, or the diastasis rectus repair, where we bring the ab muscles back towards the midline, suture them in place, make a new belly button hole in the new flap of skin, and fix a hernia if you have one. Liposuction to the flanks here, again, just to give you that nice curved hourglass shape. Okay, let's see. Anyone have any questions? I don't think I saw any questions. Okay. Well, if you do have questions, I'm always available. Oh, you're welcome. I'm always available by direct message or email or phone call. You can find all the information on my profile. Hi. And, I do kind of pretty enjoy doing these Tuesdays. I wasn't sure. Don't really like talking at myself on a camera, but at least, when you guys are here, it's a little bit more fun. I'm still not very good at multitasking. My husband says I'm horrible at multitasking. Now, if there are ways you think that I can improve the way that I talk, please just do let me know. Right now we're still doing virtual consults, but we just heard from the OC officials. It sounds like they're giving us the green light to open up the offices again. Oh, thank you. That was very nice of you. So it sounds like we'll be able to start doing things again. I mean, Governor Newsom did say last week specifically no cosmetic surgery, so we're trying to, just work together and figure out when it is safe to do elective cosmetic procedures again. Hopefully soon, hopefully by, the middle end of May. But in the meantime, we can always meet and talk, go through your consultation and kind of your goals and desires, and then make a plan to go from there. And as soon as we have the ability to move forward, then we can move forward. All right, so I hope all of you have a great night. Again, this was my virgin mint julep and my nice little copper cup, but oh, that's really good. That is really good. Okay, so I liked the drink from this week and I liked the drink from last week. I'm going to put all these videos up on my YouTube channel. You can find them there. I think we're trying to figure out how to load them onto IGTV too. So if you missed any part of it, please do check that out again. Otherwise, come in and talk with me. I would love to meet you. All right, have a good night. Bye.